Almost 2 years ago, Jeff Verrill, Michael Nitschke and myself started up SPARC, or Sports and Arthritis Clinic, with the aim of emphasising non-surgical management of common injuries and osteoarthritis.
Because we have a combination of medical practitioners or medical specialists along with allied health, the treatment regimes or interventions range substantially from education through to physical exercise regimes as well, so strength and conditioning.
We are very much a philosophy that exercise is medicine, and we take that through to our work with high performance teams and individuals in South Australia.
We often try to reserve surgical management, which is often the most dangerous and most expensive treatment around, until it's basically a last resort.
Our philosophy of seeing someone is the person should be able to understand the diagnosis they're seeing and, if possible, the cause of their diagnosis. We look at a short-term plan where we might look at pain relief and early movement, but our most important role is looking at long-term resolution of problems.
There is very little emphasis we've found in South Australia and very little presence in sports and exercise physicians, which is Jeff and myself's specialty, which is the non-surgical management of these very common injuries. Now, whether that is early knee arthritis, whether that's a hamstring strain or a recurrent rolled ankle, we often find that the non-surgical management of these things is far superior in the early days and keeps people active and moving until when or if they eventually do need surgical treatment.
I personally do a lot of gait retraining, footwear education, and setting up running programs and load management programs relative for the individual's goals and relative to their history of injury as well.
There is lots of evidence that says that doing exercise is helpful for all sorts of conditions such as osteoarthritis and medical conditions such as diabetes and asthma.
So the whole idea of SPARC is to have a good, comprehensive, multidisciplinary group, whether that is good masters sports physios around, whether there's the gym classes upstairs or sports and exercise physicians downstairs. We find that we're fairly well positioned to target the variety of musculoskeletal injuries.
The Sports and Arthritis Centre is a training centre for Australasian College of Sports and Exercise Physicians, and we were the first training centre to be established in South Australia.
The medical professionals are at the top of the food chain for diagnostics, and we get a great opportunity to collaborate with them in order to help patients get better outcomes.